In this session, we will thoroughly explain several important benefits concepts. Let's start with private benefit. Private benefit is the benefit received by the individual consumer or producer who's directly involved in the transaction. So it is the benefit felt by the decision maker. If you buy a coffee, your private benefit could be you enjoy the taste, you feel satisfied, and you feel more awake. That enjoyment is your private benefit. If you study for a qualification, your private benefits include better knowledge and skills, more job opportunities, and higher future wages. Those benefits go directly to you, so they're private benefits. Thus, private benefit is the benefit to the person making the choice. Now, external benefit. External benefit is a benefit gained by a third party who's not directly involved in the transaction. So the buyers and sellers aren't the only ones who benefit. Other people benefit too. If you get vaccinated, you reduce your chance of getting ill. That's private benefit, but you also reduce the chance of spreading disease to others. That extra protection for other people is an external benefit. When you become more educated, you gain higher wages. That's private benefit, but society gains too. Employers get more productive workers and the economy becomes more innovative. Those benefits to other people are external benefits. So external benefits is the benefit to third parties. Now we combine them. Social benefit is the total benefit to society from an economic activity. And social benefit is the sum of private benefit and external benefit. So the true benefit of something like education is larger than what students personally consider because student focuses mainly on the private benefit. Now, let's move on to the marginal benefits. And remember that marginal means the benefit from one extra unit. Marginal private benefit is the additional benefit to the consumers from consuming one more unit of a good or service. Imagine you're eating pizza. The first slice gives you a big benefit because you're hungry. The second slice still feels good but slightly less amazing. By the fourth slice, you are full, and the fifth slice might feel even unpleasant. The extra satisfaction from each additional slice falls. That is marginal private benefit, the extra satisfaction from consuming one more unit. Now, let's draw the marginal private benefit diagram. Let's put the price and benefit in monetary value on the vertical axis and put the quantity of goods and service on the horizontal axis. Here we have drawn a downward sloping curve, and we labeled it as marginal private benefit, which slopes downwards because of diminishing marginal utility. And that means as you consume more of a good, the extra satisfaction you gain from each additional unit tends to fall. When you have very little of something, another unit is very valuable. But when you already have lots, one more unit adds less extra benefit. So that's why marginal private benefit curve slopes downwards. You can also think of marginal private benefit as similar to the demand curve. It shows the willingness to pay for extra unit. Now, marginal external benefit, which is the additional benefit to third parties from consuming one more unit of a good or service. One more person getting vaccinated gives them private protection, but also reduces spread and protects other people. That extra protection to others from one more vaccination is marginal external benefit. And marginal social benefit is the total benefit to society from consuming one more unit. And it is the sum of marginal private benefit and marginal external benefit. So marginal social benefit includes the consumer's extra benefit plus the extra benefit to everyone else. Now, let's draw a diagram with marginal social benefit above marginal private benefit for every unit of goods and services. When marginal social benefit lies above marginal private benefit, there exist external benefits from consumption. Here, marginal external benefit is positive, meaning other people benefit from the consumer's consumption of the good or service. Consumers base their decisions on the private benefit, but society cares about all benefits, including those enjoyed by other people. So when external benefits exist, the buyers in the market will typically underconsume the good. For example, a student considers private benefit like higher wages, but society gains too from productivity, lower crime. By getting vaccinated, you benefit from being healthy, but others will benefit. They will benefit because disease spread falls. And by using public transport, you enjoy convenience commuting from work to home. Others will benefit from reduced congestion and lower pollution. And the vertical gap between marginal social benefit and marginal private benefit represents the marginal external benefit. It shows the extra benefit that third parties gain from one more unit being consumed. If the gap is large, it means external benefits are significant, and the market outcome is likely to be far from socially optimal outcome, which we will discuss in future videos. Now, let's consider the opposite case where marginal private benefit lies above marginal social benefit for every level of goods and service. So when marginal private benefit is above marginal social benefit, there exists external cost of consumption. Now, instead of society gaining extra benefit, society suffers extra harm arising from the consumption process. So marginal external benefit is actually negative. We could think of it as negative external effect. When marginal external benefit is negative, marginal social benefit is definitely positioned lower in the diagram. For example, when smoking, the smoker gets private benefit, such as enjoyment and relaxation, but others suffer from passive smoking, higher healthcare costs, and reduced air quality. So society's benefit is lower than the smoker's private benefit. While drinking alcohol, the drinkers they get private benefits such as enjoyment, but society may face costs arising from more accidents, more violence, more healthcare costs, and reduced productivity. So the true cost to society is lower than the private benefit of drinking alcohol. And when people participate in gambling, they derive private benefit, such as entertainment and excitement. But external effects include family stress, debt-related problems, and increased demand for public services. So in these cases, the consumer's private benefit is overstated compared with the benefit societies receive overall. And the vertical distance between marginal private benefit and marginal social benefit here represents the marginal external cost of consumption, the harm imposed on third parties. Let's summarize. So private benefit are benefits to decision makers, while external benefit are benefit to third parties, and social benefit is the sum of private and external benefit. When we introduce the concept marginal private benefit is the extra benefit to consumers from one more unit of consumption. Marginal external benefit is the extra benefit to third parties arising from one more unit of consumption. Marginal social benefit is the sum of marginal private and marginal external benefit. And marginal private benefit curve slopes downwards because of diminishing marginal utility. If external benefit exists, marginal social benefit lies above marginal private benefit. And if negative externalities of consumptions exist, marginal social benefit curve lies below marginal private benefit. And the gap, the vertical distance, shows the external effect. It is either cost or benefit from consumption.